Dear students, in this video we are going to discuss about medical billing process in hospitals. In the previous videos we have discussed about the front office operations and admission of a patient in a hospital. In this video we are going to have a discussion on how the medical billing is prepared in a hospital. For the consultation purpose or for the treatment purpose, every client is fixed up an appointment with the doctors or maybe any regular checkups or for any test purposes. So they may fix up an appointment over the phone or they can walk into the hospital directly to fix an appointment. Once the appointment is fixed, based on the appointment, the patient consult with the doctor and with registering all his relevant details, and the patient undergo a consultation and diagnosis under the guidance of the doctor. The doctors go through the previous medical history of the patient and check the patient and does the procedure as per the current illness. That means based on the present situation, even though he was getting a treatment over the period of time, they check the medical history of the patient and check the current status, and based on the feedback how the patient feels at present, so all those things he give the correct procedure or treatment according to the present state of the illness. After the procedure, the doctor gives the dictation to the medical transcriptionist. That means the doctor explains about the conditions and drugs, treatments, okay, so given for the patient, and this medical transcriptionist note down all the details and they prepare the document for medical record keeping, because it is mandatory to keep the medical record for the patient for at least 5 years. Okay, after the medical transcription is done, the documents or the reports are sent to the medical coding division. So medical coding means the coding in the software. There are standard codes are available for the hospitals. One is CPT, current procedural terminology, or ICD, international classification of diseases. So these standards, these codes are standardized throughout the world. So okay, so this coding department, they code the medical transcription that are discussed by the doctors into the medical codes into the software. All the codes are available in the coding books, okay, for each disease, for each kind of procedure, okay, for everything there is a medical coding universally accepted. So they use those codes for entering the data in the software. This process is called medical coding. Once the medical coding is over, based on the coding, the billing department prepares the medical bill. Okay, the medical bill is the document which will be submitted to the patient. Okay, so the payment has to be made against the services provided by the hospital. Okay, for preparing the medical billing, the patient information needs to be entered: name, date of birth, gender, all those necessary details, and consulting doctors, all those details must be entered. And if the patient, client, applied for insurance claim and insurance claim detailed ID number, name, insurance policy number, okay, company name, okay, the scheme on which the insurance has been taken. So all the details must be entered. Once the account on the patient name is created in the billing software, the charges can be posted for each consultation, and tests are being done, diagnosis are conducted, consultation of the doctor, procedures done, surgeries done, and drugs and medicines are recommended. Okay, so for all those things, the different departments, they are enabled to enter the payment, what is the charges against each services are provided to the particular patient. So once all the charges are received, the consolidated payment billing, consolidated medical billing is prepared and submitted to the patient, okay, to pay the amount for the services rendered by the hospital. So this is the process of preparing medical billing. So once the a patient fix up an appointment, okay, by providing all the basic details, he consult with the doctor, and based on the doctor's advices and recommendation, they undergo further procedures and treatments. Okay, so all these details are given to the medical transcriptionist. They prepare the document, okay, because the doctors, they don't have a time to prepare on their own, so they will tell all the details to the medical transcriptionist. They prepare the report on entire treatment given to the particular patient. Okay, then the medical document will be sent to the coding department, where they usually use the universal codes for converting this document into the medical codes. So that will be updated in the software. So from the medical codes department, all the details will be shared with the medical billing. Okay, the medical billing department, they will enter all the basic details about the patient and all the services available by the patient. Then they create the medical bill, and the charges are entered against each and every services that are availed by the patient or given to the patient by the hospital. Once all charges are entered, okay, the bill is prepared and submitted to the patient for the payment. So this is the procedure. If the patient pay the entire amount by cash, they can pay the cash at the cash counter. If they avail services even during the appointment, fix up an appointment, they will tell all the details about the insurance. Okay, so all the details are taken in the appointment or admission time itself. Okay, so once they give all the details, those details will be sent along with this medical bill prepared to the insurance claim company. So the concerned company which where the patient has an insurance scheme. So details sent. Okay, the insurance company, they process that. If they agree, if they offer the claim to the patient, and they will send the details about how much claim they are giving to the patient. Okay, so all those details will be sent to the hospital. The remaining amount has to be paid by the client or a patient. Okay, so this thing, so for example, your charges, total billing cost is 10,000, but the insurance company is ready to pay only 7,000 rupees as per their norms. Remaining 3,000 has to be paid by the patient. Sometimes the claim may be denied by the company because of some errors in the documents. Okay, so the insurance company, they will send the reports to the hospital. Okay, again the hospital has to rectify those error. Again it will be sent to the insurance company for further processing. This is called as a in-house uh, patient responsibility. Okay, okay, and another side is, sometimes the insurance company deny the insurance claim because under the particular scheme, the particular treatment or procedure taken, services taken by the patient won't be included or not in that particular scheme. It won't comes under the particular scheme. In those cases, they deny the uh, insurance claim. In that case, the patient has to pay the entire bill. Okay, so this is the thing how they pay the bill, whether with the help of insurance company or they make the payment 100% from their pocket. Okay, so this is the process of medical billing in hospitals.